You all so much for joining us today. We're just thrilled to be a part of this offering that Doug and NGM offer. We're just so proud and very, very thankful to be a part of this. So thank you for the opportunity to take a look at our product, and we'd love to open it up to questions after we go through a little bit of this. I'll just I think some of you are probably already aware of us, so I'll kind of be brief on our background, but I do want to say that we've been in business for 30 years, and we have really focused exclusively during that time frame on prescription benefits. We pride ourselves on our technology. We're very, very interested in being the very best partner to all of our agents and clients that we possibly can. So always open to suggestions and questions. We definitely want to be attentive to you and your needs and your clients' needs. So I don't know how much more of a background you'd like for me to go through, but maybe if you could scroll to the next page. Let's see what the next slide is.
Is this one you want, or do you need me to move forward?
Yeah, go ahead and move forward again.
Okay.
Oh, one more. There we go. Okay. So, whether you're offering this to individuals or to group plans, the benefits are really very much similar. However, I will point out that, a key component to this is just being able to make your plan more comprehensive for whoever your client may be, right? So if it's individuals or groups, your client may not be able to find access to another agent out there that will be able to offer them a fully insured prescription plan. So that's absolutely an advantage to if they use it, they buy it, they're happy with it, they're never going to want to leave you, So another thing I would just kind of point out is that specifically to group sales, on over 30 years worth of claims experience, we find that on average, members use 1.1 scripts per member per month, which is huge because, your members will use the plan. So in all reality, you're really providing a benefit that will be utilized time and time again. And, there are insurance is known for the safety it provides to members on things like, life insurance and critical illness and things like that, where cancer insurance, et cetera. So those are all extremely valuable to the member, but hopefully they never have to use them, right? So this plan is something that they will use time and time again, and it really, really does help to round out both individual and especially group side. The clients will really see this as a true value that you're providing to them.
Well, you're exactly right, Lisa. People buy health insurance, they don't go jump in a hospital bed, but when they buy a prescription drug card, they're planning on using it.
Yeah, right, exactly. Yeah, absolutely. Would you like me to go through the plans rates?
Yes. We'll go straight to the actual network. Can you explain the difference, as we got on this slide here, between network pricing, which is and traditional discount cards, basically?
Absolutely. So it's very important to understand the difference, because the main key component that makes our plans so successful and helpful to each and every client out there is the fact that we utilize network contracted rates with all of our plans. So if you were to take a typical plan, let's say that Sally Sue Johnson goes into, her neighborhood pharmacy, and she goes to get a script, and that script cost at retail pharmacy cost of $100. Then Sally Sue will pay $100. But let's say she goes in there with a discount card. And discount cards are valuable in that they do save money most of the time. However, sometimes they cost the client money on a monthly basis as well. So, you really have to kind of look and really educate yourself on that if that's the route you plan to go. But I do want to compare those plans to our fully insured plan. So if the member were to go in to the pharmacy and the drug were $100 at retail pharmacy cost, then the member will actually get some sort of discount with their discount card. So let's say they get about a $9 discount, and that's not unusual. So they pay $91, which is great. But if you compare that then to our fully insured plan, the same member, Sally Sue, walks in and she's purchased the PRAM fully insured prescription drug card coverage, and she walks into the pharmacy. The retail pharmacy cost for the drug is $100. However, I like to basically call the network contracted rate our new starting point for the cost of the drug, because in all reality, that's really what we're giving to our members, is a new starting point for the cost of the drug. So with our generic plan, we typically get somewhere between 80 and 92% discount on generic drugs. So let's say that new starting point for the cost of the drug, or our network contracted rate, becomes $15 to that member. But because we have copays on our plan, the member will still only pay $10. I apologize. The $10 copay. And then what happens is we take that $15, which is the new starting point for the drug, we minus out what the member paid, and so that leaves that $5 that gets attributed over to the monthly maximum. So, a lot of people will, when they first take a look at the plan, they'll say, oh, this plan only has $300 coverage. Well, they might go through that coverage rather quickly, right? Which, sure is sometimes true. However, I want you to really understand the true value of that $300 for the generic only plan, or $400 for the brands. I really want you to understand the true value of that monthly maximum benefit, because it's not going to be that $100 original starting point minus the $10, so $90 goes towards that monthly maximum. It doesn't work that way. It's actually going to only be from our new starting point of $15 minus the member copay of $10. So that leaves $5 that goes towards that monthly maximum. So that still leaves the member with $295 worth of coverage. So I really want you to know and understand that true value of that monthly maximum.
So that's similar to the HSP bucket of money, if you will, guys. They take the money out of your amount to do that, and each time you get a prescription. Now, this is can you kind of go over this slide here with us, Lisa, and explain this in a little more detail?
Absolutely. So this actually shows a screenshot of our drug lookup. And I do want to just kind of mention that we did launch our drug lookup, it may be as long as 2 months ago now. And we have had bugs. It's a very, very intricate and complicated system. So we have had bugs. So if you've used it before and had some funky results, please do try again. But we have had, we've gotten it pretty fine-tuned at this point. So just to kind of show you an example of how your results will show up in the highlighted section on the top left, you'll see the name of the drug, you'll see the route, you'll see the form and the dosage, days supply and quantity. And the way that it works is that you'll actually put in your zip code or your member zip code, and up to 10 different pharmacies will show up, so they can kind of cost compare per pharmacy, because the cost truly can vary widely. So, and I'll demonstrate that in just a second. So if you'll look now to the 3 columns on the right-hand side, each column represents each of the 3 different plan designs that you can offer to your members. So you'll see on some where a drug is not covered on generic, but it might be covered on the brand Wrap 1, and how those costs differ. So just realize and understand that those 3 columns actually do represent what the approximate member cost for what the member would pay on each of those different plan designs. So if you look at the top line that's boxed in red, it shows the cost of drug without coverage. So again, that's going to be representative of that $100 that Sally Sue went in and found a retail pharmacy cost for her drug. So that for this particular drug, it's $138.90. And then if you look down where the green box is, it shows the approximate member cost for someone who's on the PRAM plan, and that member cost is $1.59 at Central Drugs. At Buy Right Quality, you'll notice it's actually $1.64, and at Walgreens, you'll notice it's $4.40. So again, they can really compare costs at various pharmacies. Choose the best pharmacy with the best rate or price. And one thing I want to mention is that the $1.59, I believe this is a generic, but let's just assume this is a generic. And what happens is that even though they have a $10 copay, the member is never going to pay more than that new starting price or cost of that drug. So even though that original cost was $138.90, we were able to get it down to $1.59, and that member is never going to pay more than what we are able to get for that cost of the drug. So they're never going to pay more than the cost of the drug. So does that help to explain? Okay, great. Well, here's another example. Doug did just forward it to one additional example. Again, the drug is shown in the yellow, and the cost of the drug without coverage is $44.40. The approximate member cost is $8.13. So you'll see that that one actually remained the same at the next 3 pharmacies.
So if it's less than the copay, you'll pay the less amount.
Correct. Yes, absolutely. Every time. Mm-hmm.
These are the states that we're currently in. What about one of our guys asked me about Oregon the other day. Are we going to get this product in Oregon?
You know, I can check on that. I will tell you that we're constantly trying to get new states. We have lots of different products out there, so but I can check on this particular one and see specifically regarding Oregon.
Okay. Okay, guys. So this is the state we're currently in. For those of you that aren't appointed, we've got information. Give a TAN, and we'll get you guys appointed. That the products are basically level, pretty much level. And is there any rate increases with this product, Lisa? Can the clients expect any rate increases in the future?
Yeah, let me just tell you that in general, we really try not to increase any kind of premiums moving forward. Now, you know, I realize that most carriers in general, maybe not the ones you guys use, but most carriers in general really just have an annual increase every single year, but we really stay away from that. You know, it's more costly to the members. It's unfortunately, that's a time when members a lot of times will drop coverage, right? There's all sorts of reasons why we don't want to increase the rates. But I will just say that the only time we will is when, so we actually pool everybody together, and which is great news for individual members. It's not going to be based on their experience. If they have poor experience, in terms of using a lot of drugs, meaning they use a lot of drugs. So from a carrier's perspective, right? That might be poor, but not for the member. So if they use a lot of drugs, this assuming that everybody altogether is functioning okay, we are not going to raise that member's rates. We're only going to do it when we have to raise everybody's. And one thing we really do ask of our agents, simply because we have that guaranteed issue policy, and we truly try not to raise the rates unless we absolutely have to. One thing we really ask is for your cooperation in really trying to sign up everybody. I mean, it really is truly an opportunity for your members to have the product, and it's also an opportunity for us to be able to engage lots of people to make that pool stronger.
Yeah, guys, and I know some of us get in a situation where, since this pays, especially on individual sales, since this pays in addition or takes pre-existing conditions, a lot of you won't sign up your client until they have pre-existing conditions, and that's really not the way to do this. On individual sales, you need to package it, because when it's packaged in your presentation, the overall value of your presentation is much more powerful, because, again, you're competing against an old dinosaur major medical policy that's ridiculously priced and doesn't have a lot of great value. So you've got plenty of room to add this on top of your product and still save your client tons of money. I mean, I'm paying $60 a month, so that way you don't have to use the concept, well, we'll just wait and sell it after you get on prescription, since it takes pre-existing. Load it up, put it in on every sale, and that way your client has got the maximum coverage you can put on them, and it really increase your presentation, because we all know if you look at that outpatient, Philip American, the first thing that jumps out of us is the prescription drug coverage. And it's a reimbursement, which really goes nice on top of this copay plan. Now, on your list bills, guys, in groups, everybody gets it. Everybody, because it's guaranteed issue. Put it in your premium, not an option. Everybody gets the list bill, because you're going to have a lot of usage, and you want those level commissions. And this is what they use. People use prescription drug cards. They buy a dental policy, they're going to the dentist. They buy a drug card, they're using a drug card. Everybody uses it. And very rarely will a client use one prescription. And with our reimbursements at 3, 4, 5 prescriptions a month, it's a lot of money on top of this great product. So add it on top of your presentation, blend it in, and it makes it very powerful on your overall value of your package benefits. Do you want to talk about the dashboard or anything, Lisa? Any comments on that, on how that works?
Let's see. So I do just want to point out, hopefully you guys have all seen your dash. We are constantly updating it, and any suggestions you have, we're happy to incorporate. I do just want to point out a few things that might be things that you haven't necessarily noticed, I guess. One of which would be your invite to self-enroll, your invitation to self-enroll. So that's a unique link that you guys can send out in your emails, put it on your websites, etc. And then your members can actually enroll themselves in the program. It gets linked back to you, so you get the commission on it. Everybody's happy. So another thing I want to point out would be basically, you don't see it on this screenshot, unfortunately, but off on your right-hand side, down towards the bottom a little ways, you'll actually have a list of the states in which you've been appointed already and your sales per state. And what that's going to do is kind of give you an idea of how you're doing in each of the states, so that when it comes time for renewal on your appointments, you'll say, hey, I'm going like gangbusters in Texas, but I'm maybe not doing so well in Louisiana, so let's maybe take that one off for a time being, and then it will just help you, manage your money and a little bit better in terms of that. So let's see. We will be putting those videos on here, and if you guys are interested in getting those the videos that he just showed, so there's one that's directed towards clients, and so you guys will see that one. And what will happen is you guys will actually be able to put your name at the end of that and then send that out to clients. And we'll have that ability on that site as well. I can't think of when that will be done, but hopefully soon.
Okay. And guys, we're going to be training a lot in the next few weeks on list bills. As you guys know, Philadelphia American goes into a guaranteed issue mode with no underwriting if you've got your percentages on our list bills. And, you know, the 10 to 50-man list bill groups is a huge market for the Philadelphia American list bill product. And you're going to want to go in there and load this on every employee that we do our list bill. So when you can go in there and sell a list bill, that's one presentation. If it's got 30, 40 employees in it and they're all getting a HSP or HCS, they're getting an accident, they're getting a critical illness, they're getting a prescription drug card that pays level commissions, you're going to be, because a good agent on the individual market will maybe sell 2 or 3 families a week. That may be 100, 150 policies a year or members a year. But if you go into a group that's one presentation, you might pick up 150 policies in one presentation at one time. So it's a real exciting product we've got. We've got answers to the healthcare crisis in this country, but it takes us and our expertise and our knowledge, and we fall back on the knowledge of guys like Dave and Lisa who have been in this business for 30 years and understand it. And we do have to simplify it, and that's our job, to simplify it for the consumer. But this package of benefits stacked on top of our health and income protection plan, both individual list bill, is just, it's answering a lot of problems in the industry today. So very excited to have it. Anybody has any questions? I know, Scott, you've had, I think, Scott Foster, if you can star 6 in if you're on the call. I know you've used this several times. Maybe you have a few comments if you're on the call.
Yeah, Doug, I'll tell you, I've seen the same savings you have, obviously. I tell you, I get about, maybe 4 or 5 prescriptions a month. And I was paying, honestly, before I got PRAM, I had one of those discount cards, and I was paying about $120 a month for my prescriptions. And I said, this got to change. So when we took on the PRAM, I right away went with the Brand Wrap 2, and my costs for prescriptions a month have gone down by 90%. I spend less than $20 a month now on prescriptions.
Wow.
Yeah, it's unbelievable.
Great. I love hearing those stories.
Yeah. So we're real, again, guys, this is, this is a high-value product. Is it for all people? Not, of course not. There is no utopia. There's no all products that are all things for all people. But we have to have this in our portfolio so that when it comes time to put somebody with a prescription drug card, this is the best one on the market. And I believe in it. I've used it. I know it. It's not my first rodeo in this business. Been in it 30 years. And so again, this is, salespeople sell, but stories tell. And you just heard a story from me and Scott, guys are using it. And so we encourage everybody to take this product on and blend it in your presentations. And we'll do more training in the upcoming weeks. Any other questions or comments, guys, before we go for the day?
Hey, Lisa, this is Scott Foster. Yeah, Lisa, I got a question for you. I ran into an issue here late last week where I know a couple of the numbers that were coming up, I'd get in and quote some drugs, weren't coming up correctly. Have we got that fixed, do you know?
Yeah, so I greatly apologize for the trouble that we have had. It has been just a rather complex structure that we've been trying to build here. So you know what? I'm not exactly certain what your issues are exactly, Scott, but I will go and I will check with Diana, and we'll get back with you and make sure that you that specific thing is being addressed.
Okay, I know I've been chatting back and forth with Brad, and he says it's been a system-wide issue, so he said he'd let me know when it was fixed, and I haven't heard anything, so.
Oh, then I'll definitely check with Brad right now, actually, while we're on the call.
Okay.
And one of the things,
check
guys,
with him
we've
right
got
now.
some brochures that PRAM's actually been real helpful in designing some brochures, or helping us design some handouts, some trifolds, some brochures for this product, so we can get those to you as well, and the PDFs, and they're really helpful. You can hand those out, put them in your presentation manuals, etc. So, just a joy to work with you guys, and appreciate your responsiveness on everything we've asked of you. And we're looking forward to writing a lot of business with you guys. So, any other questions, guys,
Yes.
before we adjourn for
I have
today?
a question. How do I get appointed?
Okay. Okay. How you get appointed? You want to answer that, Lisa?
Sure. So we just need your name, first and last name, and your email address from Doug, and we'll go ahead and send you out a link, and then you just follow the prompts on the links. We do have a Friday phone call every single week that goes through the training, as well as how to get appointed and how to add a new member. So you're welcome to join us for that. Once we get your email address, you'll be invited. So that's what I would suggest, just your first and last name and your email address.
Now get with Tan, everybody. Tan Yell at nationalgroupmarketing.com, and she'll assist you with all of that. And again, we'll do some more training. We'll get into the list build training, and we're going to be training every week from here on out. It's going to get real busy. I mean, it's already real busy. We're breaking all kinds of records, guys, just so you'll know. So it's exciting to see the careers exploding back in this industry that's everybody's left over the last several years, and it just we're having a lot of fun because we're helping folks, and this is another product that we can get excited about and bring a real value proposition to these consumers, something they haven't had in years. So, if anybody any other questions, guys, star 6 your phone and jump in. Comments or questions? Okay, well.
Yeah, I'm just going to respond to Scott here real quick. I just got a response from Brad, and he said that it finally just got elevated to our Chief Technology Officer, Sean Livermore. So he actually is working on it today.
Great, thank you.
We'll get back with you as soon as we get that done. I just want to say thank you so much to everybody, and good luck.
Well,
let us know if you need
us.
anything from us.
Well, thank you for all you do, guys. You guys are doing a great job. Have fun, good selling. Have a good end of week and weekend. Thank you.
Thank you too, Doug.
Thank you, Doug.
Bye.
Thank you.
Thanks, Lisa.
Bye.